Every 66 seconds, another older adult in this country is diagnosed with dementia. By the time this video ends, dozens more families will be facing that life-changing news. Most people assume memory loss is simply an unavoidable part of getting older. But what if, for some people, there was another factor quietly contributing to those changes? A medication sitting in the bathroom cabinet. I'm Dr. Christopher Adams. After more than 15 years caring for older adults, I've seen the same story unfold again and again. Someone who was once sharp, organized, and independent begins forgetting names, missing appointments, repeating conversations, or struggling with familiar tasks. Family members often assume it's just aging. Sometimes it is, but sometimes, when we carefully review every medication they're taking, we find that one or more prescriptions may be contributing to memory problems or confusion. Here's what researchers have been studying for years. Certain medications have been associated with an increased risk of cognitive impairment or memory problems in some older adults. That doesn't mean they cause dementia. Many are important and even life-saving medications. The risk depends on the specific drug, the dose, how long it's used, and each person's overall health. The challenge is that these side effects often develop gradually, making them easy to mistake for normal aging. In today's video, I'll walk you through 9 common medication classes that doctors frequently review when evaluating memory concerns in older adults. Some of them may surprise you. One is prescribed to millions of seniors every year, and another is often considered completely routine. Yet it deserves a closer look if you or someone you love has noticed changes in memory or thinking. One important reminder before we begin: never stop taking a prescribed medication on your own. The goal of this video is to help you have a more informed conversation with your doctor or pharmacist, not to replace their advice. Let's get started with number 9. Counting down from the ones that quietly fly under the radar to the one I consider the most destructive of all. Watch closely for number 3. It's given to millions of seniors for something that sounds completely harmless, and it may be shrinking your brain's memory centers right now without a single warning sign. Before we get into it, tell me in the comments how old you are and what medications you're taking daily. I read everyone, and the age of this audience shapes what I cover next. Let's kick things off at number 9. And don't let its low ranking fool you, because this one is sitting in nearly every medicine cabinet in America. Number 9 is diphenhydramine. You likely know it by its drugstore name, Benadryl. It's a little pink pill reach for to drift off to sleep, calm an allergy, or take the edge off a cold. It costs only a few dollars, sits out on an open shelf, and most people figure that since it doesn't require a prescription, it must be gentle. Inside your brain, something quite different is going on. Benadryl falls into a class of drugs called anticholinergics, a long term for a simple concept. They block a brain chemical called acetylcholine. Acetylcholine is the messenger your brain relies on to lay down new memories and to stay alert through the day. As we age, the brain produces less of it and leans even harder on whatever remains. So, a drug that blocks it hits a 70-year-old brain much harder than a 30-year-old one. The structure that takes the brunt of it is the hippocampus, the small seahorse-shaped region where new memories are formed before being stored away. In my own practice, I've seen patients take a nightly antihistamine for years and slowly lose their edge, never connecting the fog to the pink pill beside the bed. The research is blunt about this. A 2023 paper in the Journal of Geriatric Cognitive Health tracked older adults who used anticholinergic drugs regularly and found a 54% higher risk of developing dementia compared with those who steered clear of them. More than half again the usual risk from something most of us treat like candy. Here's what to do. Look at the label on anything you take to sleep, and anything marked PM, nighttime, or allergy relief, because those are very often just Benadryl wearing a different name. If you take it for allergies, newer antihistamines like Loratine, sold as Claritin, don't cross into the brain the way Benadryl does and are considerably safer long-term. Never stop a medication on your own. Bring it up with your doctor first. But stop assuming that over-the-counter automatically means harmless for your memory. That's number 9. Number 8 is something your stomach is grateful for while your brain quietly foots the bill. Number 8 is proton pump inhibitors. The big names are omeprazole, sold as Prilosec, and esomeprazole, sold as Nexium. These shut down acid production in the stomach and get prescribed for heartburn, reflux, and that burning sensation after meals. People stay on them for years, sometimes decades, because the moment they stop, symptoms come roaring back. So, it feels like the drug is the only thing keeping things in check. Here's the part almost nobody hears at the pharmacy counter. Your stomach needs acid to pull certain nutrients from your food, chief among them vitamin B12, which protects the wiring of your nerves and brain. Turn the acid down far enough for long enough, and your B12 quietly slips. So do magnesium and calcium, two minerals your brain cells depend on to fire and signal correctly. Starve neurons of those, and you end up with misfires, confusion, and memory slips that mimic early Alzheimer's, when the real cause is a nutrient your medication has been blocking the entire time. In 2016, a large study in JAMA Neurology examined more than 73,000 people aged 75 and older. Regular PPI users showed a 44% higher risk of dementia than non-users. And the issue runs deeper than nutrients, since PPIs have also been shown to raise amyloid beta levels in the brain, the sticky protein that builds up in Alzheimer's disease. So, here's the move. If you take a PPI every single day, that's worth bringing up with your doctor. Many people can step down to a gentler class called H2 blockers, like Foden, sold as Pepsid, which is far less likely to affect cognition. Chewing deliscerinated licorice, a natural compound that coats and soothes the stomach lining, can ease symptoms with no cost to the brain whatsoever. The goal is the lowest dose for the shortest duration, not a pill taken forever purely out of habit. Number 7 is prescribed for an issue most people would rather avoid discussing. Number 7 is bladder medications, and the one worth knowing by name is oxybutynin, sold as Ditropan. It's given to seniors dealing with sudden urgent trips to the bathroom, the kind of overactive bladder that can take over an entire day. The relief is genuine, and the embarrassment it spares people is genuine too. But oxybutynin works by blocking acetylcholine, the same memory chemical Benadryl blocks. And this one slips into the brain very easily, lodging right where memories form. That makes it one of the riskier entries on this list for an older adult, particularly with prolonged use year after year. In 2019, the British Medical Journal published a study of people over 65 who took strong anticholinergic drugs like oxybutynin for more than a year. Their dementia risk climbed 49% higher, close to 1 in 2. And here's what troubles me most. Almost none of them were ever warned. They were told a pill would settle the bladder. Nobody mentioned it might also be dimming their mind. The fog gets pinned on age. People describe forgetting appointments, misplacing their keys 10 times a day, losing track of a simple conversation, and everyone around them nods and says, "Well, you're getting older." It's rarely traced back to the prescription until real ground has already slipped away. If you take oxybutynin and you've noticed your memory fading, take that seriously, because you don't have to choose between your bladder and your brain. Newer drugs like Miragron, sold as Myrbetriq, work through a completely different pathway and don't block acetylcholine at all. For most older adults, they deliver similar control with far less cognitive risk. Bring it up at your next visit. Number 6 might be the most unexpected entry on this list, since it's one of the most prescribed drugs anywhere. Number 6 is statins. Svevastatin and atorvastatin, sold as Zocor and Lipitor, rank among the most widely prescribed medicines in the world, especially after age 60. And they do crucial work, lowering cholesterol and cutting the risk of heart attack and stroke. Statins have a rightful place in a lot of people's lives, and this isn't an argument against using them. What follows is the half of the story that usually gets left out. Cholesterol does far more than affect your heart. Your brain is close to 60% fat, and it relies on cholesterol to build the myelin sheath, the insulation wrapped around every nerve, so signals travel quickly and cleanly. Push cholesterol down hard enough with a strong enough statin, and you can leave the brain short of a raw material it genuinely needs. The statins causing the most trouble are the ones that pass easily into brain tissue. In 2023, a study in Frontiers in Aging Neuroscience found that adults over 70 who'd been on statins for more than 3 years had a 26% higher rate of mild cognitive impairment. And the higher the dose, the sharper the decline. Some patients describe unsettling gaps. A familiar name vanished, a conversation just finished forgotten, a route driven for 20 years suddenly unfamiliar. The key point to grasp is that not every statin affects the brain identically. Pravastatin and fluotin don't cross into brain tissue as readily and are generally seen as safer picks for preserving cognitive function. So if you've been on a statin for years and you're noticing fog, forgetfulness, or confusion setting in, that's a genuine conversation to have with your doctor about a lower dose or a switch. It's not a reason to quietly stop a medication that may be guarding your heart. Get the plan right with professional guidance, never solo. Quick pause. If this is helping connect the dots for you, take 1 second and tap that like button. It genuinely helps this information reach more seniors who need to hear it. And while you're down there, tell me how many prescriptions you're currently on. I read every comment. All right, back to the countdown. Number 5 is benzodiazepines. Lorazepam sold as Ativan, diazepam sold as Valium, alprazolam sold as Xanax. These rank among the most commonly prescribed drugs in America for anxiety and sleep issues. They work by boosting GABA, the brain's natural calming signal that dials down an overactive nervous system. At first, they can feel like a lifeline. The panic eases, racing thoughts slow, sleep finally arrives. But over time, the picture changes. A 2022 study in the British Medical Journal followed more than 8,000 seniors for 6 years and found that those who used benzodiazepines for longer than 3 years, months, had a 51% higher risk of developing Alzheimer's disease. The longer-acting medications, such as diazepam, appeared even riskier because they linger in the body longer and accumulate in fatty tissue, including the brain. What these medications do is produce a slow chemical sedation across the whole brain. Learning slows. Mental flexibility drops. Many people describe a kind of emotional numbness, as if they were moving through fog and no longer feel quite like themselves. The cruelest part is the exit. If a benzodiazepine is stopped abruptly, anxiety and insomnia often return even stronger, paired with agitation that can turn genuinely dangerous. That makes the medication feel indispensable at precisely the moment it may be causing the most harm. So, here's the rule, and it matters. If you've been taking benzodiazepine for more than a few weeks, don't stop suddenly, since doing so can be life-threatening. Work closely with your doctor to taper down gradually over weeks or even months. Gentler alternatives exist. Buspirone, for example, can ease anxiety without sedation or mental fog. There are also specialized forms of talk therapy built for insomnia and anxiety that can restore calm without the cognitive toll. Now, let's move on to number 4. Number 4 is a single medication prescribed for 3 separate problems, and it carries one of the heaviest hidden burdens on this list. Number 4 is amitriptyline sold as Elvil. It's an older antidepressant still widely prescribed today for nerve pain, sleep trouble, and even migraine prevention. That versatility is exactly why it became so common. It looks like a drug that can do everything, but beneath the surface, it's one of the most potent anti-cholinergic drugs still in regular use. That means it strongly blocks acetylcholine, the very chemical your neurons depend on to communicate and store new memories. It blocks acetylcholine so forcefully that with long-term use, memory problems stop being a rare side effect and start looking like an expected outcome. In 2015, a large study in JAMA Internal Medicine followed more than 3,400 adults aged 65 and older. Those with the highest cumulative exposure to anticholinergic drugs such as amitriptyline over a 10-year span had a 54% greater risk of developing dementia, and almost none of them were ever warned the medication could do that. They were prescribed it for sleep or pain, then gradually noticed words slipping away, memory thinning, concentration weakening, and simply chalked it up to getting older. It doesn't even take a high dose. A small nightly dose taken for years can quietly erode cognitive function with no obvious warning signs until the loss becomes substantial. If you or someone you love takes amitriptyline, that's a conversation worth having soon. For nerve pain, options such as duloxetine or gabapentin may provide similar relief without the same anticholinergic load. For sleep, melatonin or a very low dose of dosipin, which is considerably gentler on this pathway, may serve as alternatives. And for mood disorders, newer antidepressants such as sertraline, escitalopram are generally considered far safer for long-term brain health. Number 3 is the one I flagged earlier, because it's prescribed to millions of people for something that sounds entirely harmless. Number 3 is paroxetine, sold as Paxil. It's one of the most widely prescribed members of a family of antidepressants known as SSRI, is used for both depression and anxiety. On the surface, it appears to be a modern, gentle option, far kinder than many older psychiatric medications. But here's the detail rarely discussed. Paroxetine is the one SSRI with strong anticholinergic activity. That single trait separates it from related medications such as sertraline and escitalopram because it disrupts the same acetylcholine system that every other drug on this list has been disrupting. In 2021, a large review in Frontiers in Psychiatry examined older adults taking different SSRs and found that paroxetine users showed measurable drops in short-term memory, word recall, and attention within the first 12 months. Seniors taking paroxetine were 30% more likely to show early signs of cognitive impairment than those on other antidepressants. There's a bitter irony in that. The medication is prescribed to help stabilize the mind, yet over time, it may chip away at the very clarity it was meant to protect. The fix here is simple. In older adults, paroxetine is generally a medication worth steering away from when alternatives exist. The American Geriatric Society placed it on the Beers list, a formal catalog of medications considered potentially inappropriate for seniors, and paroxetine lands there for precisely these reasons. If you take it, talk to your doctor about switching to a safer SSRI, such as sertraline or escitalopram, which are gentler and don't carry the same cognitive risks. Maintaining healthy levels of B vitamins, especially B12 and B6, may also help support mood alongside these changes. Number 2 is prescribed so quietly that many people taking it don't even realize what category it belongs to. Number 2 is antipsychotic medication. And this one worries me deeply because many people taking these drugs never knowingly signed up to take an antipsychotic. The names include quetiapine sold as Seroquel, risperidone sold as Respol, and olanzapine sold as Zyprexa. These medications were originally developed and approved for serious psychiatric conditions such as schizophrenia and bipolar disorder. Today, though, they're frequently prescribed off-label to older adults for sleep problems, mild restlessness, or agitation linked to dementia itself. Powerful drugs built for severe psychiatric illness are now routinely used in homes and care facilities for seniors who are simply confused, restless, or difficult for stretch-thin caregivers to handle. The cost can be steep. In 2022, a study in Lancet Healthy Longevity followed more than 25,000 older adults and found that those given antipsychotics for behavioral symptoms were 71% more likely to experience worsening cognitive decline within a year, even with no prior history of dementia. These medications can also raise the risk of stroke, sudden cardiac death, and the heavy sedation that contributes to falls and hospital stays. They work by suppressing dopamine, a chemical connected not just to mood, but also to focus, planning, and memory. Suppress dopamine enough, and the brain grows slower and less responsive. That's why some people on these medications can seem dull, emotionally flat, or nearly absent while their families grieve the slow disappearance of someone who's still physically there. If you or a loved one is on one of these medications, the first step is asking the prescribing doctor a direct question. Why was this started, and is it truly necessary, or is it mainly for convenience? Many behavioral symptoms can often improve without medication at all, through consistent daily routines, less noise and overstimulation, treating hidden pain, and better sleep and lighting. When medication is genuinely required, the lowest effective dose for the shortest possible stretch helps limit the harm. Far too often, families are never told what these medications can do to the brain. They watch a decline they assume is simply aging when the true cause may be chemical. Now, we arrive at number one. Number one isn't a single medication at all, and it may be the biggest hidden driver behind every story covered today. Number one is anticholinergic polypharm pharmacy. It's the danger almost nobody talks about, and it may be one of the leading causes of medication-induced memory loss in older adults. You were probably expecting one final villain, one single worst pill. The reality is more nuanced. The greatest danger often comes from the slow buildup of several anticholinergic medications taken together, with nobody ever tallying the total load. Polypharm pharmacy simply means taking many medications at once. Anticholinergic burden refers to the combined effect of all those medications blocking the same memory-related chemicals simultaneously. Picture a very common scenario. A senior takes Benadryl every night for sleep, oxybutynin every day for bladder control, and amitriptyline for nerve pain. Individually, each medication might produce only a small, barely noticeable effect. Together, though, effects stack up and the load on the brain rises fast. In 2022, a study in Age and Aging tracked more than 280,000 older adults and found that those with the highest anticholinergic burden had a 120% higher risk of dementia within 10 years, more than double the risk. And the vast majority had no clue they were even taking anticholinergic medications. No one had ever explained it to them. When acetylcholine is blocked from several directions at once, the brain doesn't simply slow down. Neurons can begin to weaken from underuse. Connections may shrink, and the brain can settle into a quiet, underpowered state that closely resembles Alzheimer's disease on cognitive testing. Here's the hopeful part, and it's the reason I made this video. Medication-induced cognitive decline is often reversible when caught early. Reduce the burden, and many people regain clarity, energy, and memory within weeks or months. The brain is far more resilient than most people assume, but only once the source of harm is removed. The fix doesn't require a miracle. It requires a careful medication review. Sit down with your doctor or pharmacist and go through every prescription, every over-the-counter product, and every supplement you take. Tally the total anticholinergic burden. Simple scoring tools exist to help identify that risk. Once the problematic medications are flagged, unnecessary drugs can be reduced or discontinued under medical supervision. Safer alternatives can be introduced, and the brain can be given a genuine chance to recover. This may be the most preventable threat to the aging brain on this entire list. And that's exactly why it claims the number one spot. Now, I want to hear from you. Of these 9 medications, which ones are sitting in your medicine cabinet right now? Have you noticed brain fog or growing forgetfulness after starting a new medication? Tell me in the comments below and tell me you'll ask for a medication review this week. Your answer might be the very thing that helps the next person reading it. And before you go, there's one more place your body hides its warnings. Your medicine cabinet is one place. Your hands are another. Your fingernails can reveal warning signs tied to your kidneys, your blood, and even your nervous system years before other symptoms show up. Most people never learn what to look for. That's the topic of the next video. I'll show you the 4 nail signs worth checking tonight. I'm Dr. Christopher Adams. Stay sharp, and I'll see